Now that we have taken a look at the diagram related to the sympathetic nervous system, I have drawn a diagram for the parasympathetic nervous system in blue. And once again, if you are capable of redrawing this diagram and discussing the parts that are here within the picture, you should be able to answer most of the questions that I would be asking on an exam. And this diagram, I believe, does a fairly good job of summarizing all of the special things that occur within the parasympathetic nervous system. So where we should begin is with the name of the parasympathetic nervous system. Parasympathetic is sort of the functional name of this side of the nervous system, and it essentially corresponds to rest and digest. Whereas the sympathetic side of the autonomic nervous system mobilized energy so that you could survive your environment. This is going to promote the buildup of energy and the storing of energy, and you're going to get this energy from the nutrients and other components that you're getting within your digestive system. So this side, when it is active, is actually going to turn on the digestive system, cause the breakdown of foodstuffs and the reabsorption of energy molecules so that they can be stored, and the next time you have some sort of physical assault or physical activity that you need to do, you will have the energy to do so. And so this side is sort of going to reset your metabolism, allow you to rest a little bit, and use your digestive system to restore the energy that you used in a stressful situation. The other part of the name is cranial sacral. And so this is giving you the location of the preganglionic neurons. Thus, the preganglionic neurons will be located in the brain and brainstem, and therefore be associated with cranial nerves that are coming off from the brain and brainstem. Additionally, the sacral portion of the name tells you that you are going to have preganglionics located in the sacral portion of the spinal cord, and this is typically associated with nerve roots S2 through S4. Now, if we take a look at the structure of the two neuron simple series circuit, here you can see that I have drawn a preganglionic neuron, and it is relatively much longer than what we saw in the other division of the autonomic nervous system. And that is because the preganglionics within the parasympathetic nervous system are going to be coming off from the brain, and typically they're going to go quite a distance before they actually innervate or come in contact with the parasympathetic ganglia. Now, immediately you're going to learn that cranial nerves 3, 7, and 9, all of the ganglia associated with them are still in the skull. So maybe these don't have to go very far, but cranial nerve 10 basically travels almost the entire length of the trunk. And so when you look at an average and then make a comparison to what is happening in the sympathetic side, the preganglionic neuron of the autonomic nervous system is extremely much longer than what is typical that you see on the sympathetic side. So this neuron is long, it's usually traveling quite a distance. It is also going to be myelinated, and then once you get to the postganglionic neuron, the preganglionic neuron is going to release acetylcholine, and this is going to bind to a nicotinic receptor. And so this is always going to be stimulatory and cause the release of acetylcholine from the much shorter, unmyelinated postganglionic neuron. And this is going to release acetylcholine onto a muscarinic receptor. Now, you have several muscarinic receptors, and thus you can have, again, a dual innervation with what's happening here. So there could be a contraction, or there could be a secretion, or there might actually be a halt to the secretion. And so this, again, can sort of be plus or negative, depending on the type of receptor that the acetylcholine binds to. So let's take a look at where these ganglia are located and the path that they're going to take. So Again, this is cranial sacral, so the only parasympathetic outflow that we have is going to be going through the cranial nerves and then the pelvic splanchnic nerves that are associated with S, 2, 3, and 4. The cranial nerves that have parasympathetic outflow are 3, 7, 9, and 10. And this can be easy to remember if you draw your little tongue and remember that 7, 9, and 10 have taste sensation. So all you have to do is add 3 to that and you get the 4 cranial nerves that have parasympathetic outflow. Now, cranial nerve 3 is going to go to the ciliary ganglia. And the ciliary ganglia is actually located in the orbit. It is going to be lateral to the optic nerve, but it is going to be medial to lateral rectus. And because it's in the socket, this is then going to control all of the intrinsic muscles of the eye. This is going to be primarily responsible for the control of the muscles in the iris to control the size of the pupil. Cranial nerve 7 is going to be actually innervating 2 ganglia. It is going to go to the pterygopalatine ganglia, and this is located just posterior to the middle concha of your nose. And this is going to send innervation to the lacrimal gland to allow you to cry and secrete tears. It is also going to innervate the mucosa of the nasopharynx so that you are secreting mucus and you are maintaining that mucous membrane and the moisture on the mucous membrane of the nasopharynx. Cranial nerve 7 is also going to innervate the submandibular ganglia, and it is going to be on the wall of hyoglossus. So hyoglossus will be traveling up from the hyoid bone to the tongue, and it will be on the lateral edge of that muscle just above the submandibular salivary gland. And it is going to innervate the submandibular salivary gland and the sublingual salivary gland, and this is going to cause the secretion of saliva. And this makes sense because it's part of the rest and digest portion of the autonomic nervous system, and in order to digest, I have to release saliva. So this is going to cause me to salivate. Cranial nerve 9 is going to go to the otic ganglia. The otic ganglia is located just inferior to the foramen ovale in the temporal bone. And it is then going to send its postganglionic neurons to the parotid gland. And this is your largest salivary gland here just behind the muscle of masseter. Cranial nerve 10 is going to actually handle about 80% of the parasympathetic outflow of the cranial nerves. And it is going to go to intramural ganglia. Now we call them intramural ganglia because they're located actually inside the organs that are going to be receiving the parasympathetic input. So, for instance, sinoatrial node would be considered an intramural ganglia because it's located right in the heart. And the parasympathetic outflow would then regulate heart rate based on the innervation from cranial nerve 10 to that. Now, that's just one of the intramural ganglia that has a name. The others just exist within the tissues of the organ and may not have a name other than it's an intramural ganglia. So you'll find them in the lungs, the heart, and loaded within the digestive system. So you can see that parasympathetic outflow to the thoracic cavity is coming from cranial nerve 10. And the digestive system, vagus is going to innervate the pharynx through the recurrent laryngeal nerve, and that's actually going to be somatic motor because that's voice box. But it's innervating the larynx, the esophagus, down to the diaphragm. The vagus will then pass through the diaphragm as the vagal trunks. It'll innervate the stomach, the duodenum, the jejunum, the ileum, and then the large intestine from the ileum to the ascending colon to the transverse colon to the upper half of the descending colon. The lower half of the descending colon, the sigmoid colon, the rectum, that is going to be the area that the pelvic splanchnic are going to cover. So you can see that the digestive system is split between the cranial nerve 10 and the pelvic splanchnic output, but pelvic splanchnic is a lot less of the digestive system than cranial nerve 10. Pelvic splanchnic is going to send its preganglionic fibers through S2, 3, and 4, and that is going to enter the pelvis. It is going to innervate the lower portion of the digestive system, which I've just mentioned, and it is also going to then innervate the pelvic viscera and also the genitalia. Now, if you want an overall view of what the parasympathetic nervous system is going to be doing, it is the mnemonic SLOOD. And SLOOD stands for salivation, not salvation, salivation, lacrimation, crying, urination, defecation, and then the ability to get an erection. And this is an erection for a male or a female because in both genders you have an engorgement of blood of the genitalia that allow you then to prepare for an orgasm. So if this is what is allowing you to have an erection, then it is going to be the sympathetic nervous system that is going to allow you to have an orgasm. And what we quickly then seem to realize, or at least hopefully you realize, that the parasympathetic and sympathetic sides of the autonomic nervous system are working sort of in tandem with one another so that you can stay within homeostasis and also react appropriately to stressors that come into your environment and you have to meet. So we'll start with the parasympathetic side. Parasympathetic side allows you to store energy and have energy available so that when you need a sympathetic response, the sympathetic side then turns on and uses those stores and allows you to survive. So they seem to be working in tandem and synergetically so that you are able to meet all of the challenges of your environment. And you can almost think of it as a yin and yang system where the wheel turns and the energy is released so that you stay alive. Now, a lot of people look at them as being sort of antagonistic, and I suppose they sort of are, because this one turns on the digestive system, the sympathetic turns it off, and many of their responses might look like they're opposite to one another, but if you look at it more closely, they're working synergistically so that the energy is available, it's stored, the energy is used, the energy then is replaced and restored. And so you really need equal opportunities of both of these so that you can meet all of the challenges of your environment, because staying alive is a challenge, especially in 2020.